Live from ZTN Studios in Harare, Zimbabwe. Welcome to the Mint Special. Our discussion this morning is telemedicine safe and secure for Zimbabwe? Good morning, I'm Andy Hodges. This broadcast is brought to you by Zim Papers TV Network ZTN and our partners, the Internet Society Zimbabwe Chapter or ISOC Zim. If you have any comments or views on our program this morning, please feel free to contact us via our Facebook page, Zim Papers TV Network, or via our Twitter handle @ZTN News. Telemedicine is not new. It refers to the practice of caring for patients remotely when the provider and patient are not physically present with each other. It is a tool that has made healthcare more accessible, cost-effective, that increases patient engagement. Telemedicine is a technology-based alternative to traditional health care delivery. Modern technology has enabled doctors to consult patients by using what they call HIPAA-compliant video conferencing tools. The use of telemedicine has risen, of course, due to lockdown measures brought about by the COVID-19 pandemic. Concerns still exist about the poor security measures in telemedicine services, which can have an adverse impact on the quality of care provided, regardless of the chronic condition being studied. Joining us today to discuss is telemedicine safe and secure for Zimbabwe. We're joined in the studio by Sarathiel Chiapa, Information Systems Specialist, Higher Life Foundation, and Jasper Mangwana, President, Internet Society Zimbabwe Chapter, ISOC Zim. And we'll be joined virtually by Dr. Portia Mangazira, Director, Epidemiology and Disease Control at the Ministry of Health and Childcare here in Zimbabwe. Ladies and gentlemen, welcome to the Mint Special.
Thank you, Andy.
Now, in our first segment, we ask, what is telemedicine? Can it be used effectively in Zimbabwe? And is Zimbabwe ready for telemedicine? Sarathiel, the World Health Organization, or WHO, refers to telemedicine as healing from a distance. What exactly is telemedicine, and how does it differ from traditional healthcare services?
Telemedicine, as the word spells out, tele is meant from a distance. What WHO has actually done is there are communities that are at risk. There are communities who are far away from medical expertise. And these communities still need to be treated because of various diseases. But because they don't have expertise, what it means is you are now linking up with an expert or a medical doctor who is a distance away, maybe in the capital city because they don't want to come and stay in the rural area, or maybe in a foreign country. Then you reach them via telecommunication systems and then be able to consult with that doctor. You want to then verify, get help or get trained on the expertise so that you can effectively treat the patient at a lower cost to the patient. Because that patient, as you may be aware, does not have enough finance to probably travel to town or travel to a specialist hospital where they can get assistance.
So basically then it takes away that physicalness of a doctor-patient relationship. I don't have to go to a hospital, I don't have to go to a consulting room, I can do everything remotely.
Yes, there is no face-to-face consultation with the doctor in this particular case because you're now relying on the technology to interface the two parties that have got to be in that consultation.
We're going to get deeper into the technology that's used and also some of the risks later in the program. We're now joined by Dr. Portia Mangazira. She's Director, Epidemiology and Disease Control, Ministry of Health and Child Care in Zimbabwe. Portia, welcome to the Mint Special.
Thank you very much for having me, and good morning to the fellow panelists. Good morning to our listeners.
Thank you. Good morning to you too. Portia, let's start with some of the basics. What factors have influenced the rise of telemedicine in the world, and looking at it in the Zimbabwe context in particular?
Okay, so thank you very much. A number of factors, as has been said, tele means from a distance. Within our health service delivery systems in developing countries, Zimbabwe included, we tend to have a concentration of the expertise or the skilled medical providers within large urban areas and scarcity of those skills in the peripheries. So some of it is geographical distance, but also the issues around the institutions themselves, which are at subnational level, which may not attract the requisite skill. So you want to ensure that the patients that are living far away from urban areas or from the large health institutions can still get the same quality of health services. Some of it is also to do with the skills mix. We have had situations where we have maybe one psychiatrist for a large population. So you want to without moving the patient or without moving the expert. You want to convey the information and the advice. So that's in terms of health service delivery. But in terms of continuing professional development, you would also want a situation where colleagues that are working at subnational level don't necessarily have to travel to Harare or Bulawayo to access continuing professional development. So it works, and it has been seen to work very well across a lot of the medical disciplines. Pathology, instead of sending the patient with their x-ray, just send the x-ray so that it's read, and then the consultation and information is fed back to the junior or the lower level cadre by a specialized cadre.
Great,
So
thank you.
Yes. Okay.
Thank you. Thanks for that, Portia. I think Portia said that they're quality service, Jasper. But the issue, of course, is telemedicine utilizes technology. The most common form, as I said in my opening, is HIPAA compliant technology. And of course, those of us who aren't IT experts, we always wonder what this means. So what is that? And is there any other technology required to make telemedicine work effectively, particularly in Zimbabwe's situation?
Thank you so much, Andy. I think you bring in quite important issues, because we're looking at the Health Insurance Portability and Accountability Act, which looks at the fundamentals. Health is different from someone selling in a tuck shop. You look at the product and it's written best before this date. So we're looking at also at the insurance of people's health, because at times it's important for us to safeguard everything that we have to ensure that we save lives. So this act was meant to ensure that wherever we bring in telemedicine, we look into those issues that affect the insurance of the people that are associated with the services to come, number two, the portability of the applications that we're bringing on board. And over and above that is the accountability part. You know, when you visit a hospital, people always argue that when your handwriting is not so good, you most likely you become a doctor. Because that's accountability, to say I'm the person who's in charge or responsible for what has happened. So if you come to Zimbabwe, I believe there are so many laws that we should look into to promote the technology that has come on board. Of course, regulation being one of the important issues that we have to look at. But over and above, I believe telemedicine is already in practice. It's just that people are just ignoring it. There might not be regulation in the country, but our people in this country are already doing it.
I mean, you bring a good point there, in the sense that the technology is critical for it to work effectively, and of course it has to be widespread. And we'll talk regulations later. The aligning of different laws that are all over the place, different laws covering different sectors. Because, and let me be clear, regulations in most countries, including developed countries, haven't actually caught up with telemedicine as well. So Zimbabwe would be no different. Portia, let me come back to you. Is telemedicine effective in treating patients, and how exactly does it do this? Because I understand that you were involved in launching a telemedicine project, I believe, in Nyanga. Maybe you could talk us through some of that and give us real practical examples of exactly how telemedicine is working in Zimbabwe.
Okay. So thank you very much. And we do have a precedent. You know, under the government of national unity in this country, there was the Ministry of the ICT ministry was sort of born, and that ushered in a number of legislative procedures to be put in place. And I'm just trying to talk to the earlier discussion in terms of the laws and regulations. But sometimes we want to complicate things and think this is high tech. Telemedicine can just be as simple as using a media to forward information. Like I'm saying, you are trying to get away from the geographical issues of moving either the patient or the expert. So you just want to ensure that that process is done, and there is pre-referral consultation and discussion and sharing of information about the patient before you make the decision to actually physically move the patient. Having said that, our telemedicine project was then co-sponsored by the Ministry of ICT and Ministry of Health being the beneficiary, with technical support and even resources from the International Telecommunications Union. And we picked Nyanga because they were already making use of telereferral from the clinics to the district hospital, but not yet to the province and the central level referral. So this is a project that has remained in pilot phase because unfortunately there's been a lot of change of guard within our ministries. But we are anxious to finalize it because what we then did was to extend beyond just Nyanga district into Chimanimani and link the clinics within those two districts to their provincial hospital in Mutare, and then attempt to link that to Parañato Hospital. And at Parañato Hospital, there had already been some teleconsultations between India and the central hospital. So we were trying to, as much as possible, build on what is already being done or being implemented so that we comprehensively look at other aspects so that we come up with a pilot that can now be rolled out nationally, but that is still yet to be done.
Mm-hmm. So at least some steps have been taken, Sarathiel, particularly in Zimbabwe. But let's look at some of the three common types of telemedicine. And here I talk about interactive medicine, which allows patients and physicians to communicate in real time using the HIPAA compliance technology. Store and forward, which permits providers to share patient information with a practitioner in another location. So therefore, if you're a doctor in Bulawayo, you can ask your doctor in Harare to send your patient information onwards. Remote patient monitoring, which allows remote caregivers to monitor patients that reside at home by using mobile medical devices to collect data. I know in the UK they use this quite extensively. I know my own mother had one actually in the United Kingdom for a heart condition. So maybe take us through some of these common types, but also what type do you think, because this is a rolling out project. I can't imagine that we can all leap in for telemedicine from day one. What sort of types of those three do you think would be the first stages that we should get to in Zimbabwe, or at least that we can implement immediately? So okay.
What we can implement immediately is actually the store and forward. The store and forward allows connectivity between the hospital and the patient in such a way that you can actually use ordinary email. The doctor probably, they take a video or they take a picture or they take an x-ray, which they can attach to an email and then send it to an expert to analyze. They do the analysis and then they do their recommendations and be able to then email back the responses, which then the expert who's local on the ground be able to then utilize in terms of treating the patient. So that one in itself, we're already using email widely, or we're already using WhatsApp. You can actually send it on WhatsApp.
As Portia said, let's not make this complicated.
Yes.
Basically, we can use our tools that are there now.
That we already have.
Right.
Because if you look at the extent in which WhatsApp is being used to communicate, sending pictures and video, we can actually use the same technology. The nurse can actually use record, take pictures, and send to the expert, and then wait for a response to come back. So that we can start with that. Because the live conferencing requires a lot of bandwidth, it requires a lot of data, and that's quite expensive. So that will be a next stage once our infrastructure has been developed to such an extent that we're able to push video and data at high speed.
And I suppose remote patient monitoring, I mean, this idea of having a monitor at home, that also requires a robust health system, robust ambulance system, and so forth, so that you can monitor and a doctor to call straight away if something happens, I suppose.
Yes, that actually happens, because we're seeing a lot of apps that are being developed where a patient at home can actually use that app to communicate with the doctor, because the mobile phone is a device now which is multifaceted in terms of what it can actually do. It will be able probably to measure your temperature, it will be able to probably take a video, it may be able to do a number of other things in terms of you personally communicating with someone who's monitoring you at a distance. So we can use that basic technology.
All right, okay, but at least we can take a few steps. We now have to take a breather. You're watching the Mint Special. Our discussion this morning is telemedicine safe and secure for Zimbabwe. This broadcast is brought to you by Zimpaper's TV network ZTN and our partners, the Internet Society Zimbabwe chapter, or ISOC Zimbabwe. And by the way, please look at their website and join up. It's quite easy to join up, and ISOC personnel will be able to help you do that. In our next segment, we ask, does Zimbabwe have the right infrastructure for telemedicine? And what are the benefits of telemedicine to Zimbabwe? Don't go away. The Mint Special will be right back. Welcome back to the Mint Special. Our discussion this morning is telemedicine safe and secure for Zimbabwe? This broadcast is brought to you by Zimpapers TV network, ZTN, and our partners, the Internet Society Zimbabwe chapter, or ISOC Zimbabwe. Please also visit the ISOC website, which is isoc.org.zw, isoc.org.zw, and you get all the information about the Internet Society Zimbabwe chapter. Portia, I just want to ask you this. We talked earlier in the first segment about regulatory issues and so forth. I think Jasper mentioned it. So is Zimbabwe ready for telemedicine as patients, health practitioners, as well as policy regulators?
So I think, yes, Zimbabwe is ready because there's been quite a lot of work put into telemedicine over time. I remember the first meetings we're having were in 2008. Under the auspices of SADC, and then the Pan-African e-network project that was government of India and several African governments. So there's been quite a lot of groundwork done, and I remember a number of ministries, including Ministry of Justice, calling us for meetings just to look around legal frameworks. And then you did mention in the last segment issues to do with infrastructure, and that was part of the collaboration with Ministry of ICT. Admittedly, if a ministry or a government or unit tries to go it alone, of course you can't provide the infrastructure, the legal framework, the technical capacitation of the healthcare workers, and then the information and messaging for the communities. By the way, it also has to be acceptable by the community why they can't see the doctor and they can only see this doctor on a screen, or not even see them in the case of what was being discussed earlier, feed-forward messaging about the patient. So there's a lot of work that needs to be done. But I would say...
Look at that. I mean, you're right. I mean, Zimbabweans like to see their doctor in person. They like to see the nurse in person. I mean, it's part of our DNA. So you're right. That communication issue is vital, isn't it?
Yes, indeed. But I think if they are taught, well, they know the distance to the next referral level, and sometimes the condition of the patient doesn't quite allow your 2-hour journey. So why not use a few minutes, bring the doctor or the practitioner on a screen? It's surely the next best thing, because now this doctor can actually talk to the patient and to the junior practitioner.
Right.
So it's actually an amazing plan B or next option.
Right, yeah, it is.
But it's life-saving in the sense that some of our referrals, we have really incurred a lot of complications, even demise of patients, en route to the next level, when in fact we could just do the tele-referral and teleconsultation.
So this can actually save lives. That's the bottom line, isn't it? Yeah. Jasper, in most other countries that use telemedicine, we talked about HIPAA-compliant video technology. That's what's mostly used for it. In a country like Zimbabwe, where 80% or around there of the population lives in rural areas, and they have no access to such technology. Furthermore, obviously, the costs associated with internet services can be prohibitive, not only to rural people, but also to urban dwellers. So how do you see these challenges being overcome? Or is this service currently more for town people, if I can call us that, who can afford it and have access to the right technology?
No, not really, Andy. I think this technology is actually even far much better for those in the rural areas. Because if you look at the hassles and the struggles they have to meet a doctor, you have to transport your own mother from a rural community to come into RI to just see a general practitioner. Because we know also doctors are people who also making money, because we know there are always challenges in the public health sector. So at times you incur a lot of costs. If this application has been given, there's quite a lot of things happening, and blockchain technologies are coming in, assisting, providing solutions for telemedicine. But our issue, as we also move on, is in terms of integration. We can't have each and every legal practitioner providing a separate service on his own, because at the end of the day we need to integrate and share the resources. If we're going to advocate to say let's have the scan and send to the next person to assist, we need to have a central database or central control system where there's going to be integration between different health service providers. That's the reason why the government becomes the key player in this application, because we can't have those in Murrambinda operating in isolation using a different platform. We also have a lot of other cases that are also coming in, and people in the rural communities, our fear is because they're not exposed to technology. Any message that comes on WhatsApp to them, they might believe it. If you look at the rise in terms of false information on COVID-19, then imagine if we're going to have a system where someone in rural community is consulting myself, who's not even who doesn't even have biology.
Let me put it this way though. Here I am, I live in a rural area, Gokwe or Binga or wherever it may be. I won't call those rural, but out there in the countryside. And how do I do it though? I don't have the technology, I don't have video conferencing. I probably have a basic cell phone which has WhatsApp, maybe has email, maybe, but most people are WhatsApp. How would you integrate it into that? How can we make it effective with the current infrastructure we have?
One thing that I've noted in terms of our health structure, we do have the primary care, secondary care, tertiary, and the fourth one. So whatever this service is to be provided, I think the government should look into someone who's going to be assisting on the primary care. That's the reason why we have a lot of nurses coming on board. So if this consultation does not have to happen independently, so that you can't be really just the patient and the doctor without someone else who's a medical person on the background. Because with the technologies that we have, we might end up giving people things that might be difficult and also taking them on the sideways.
Sarathea, let me ask you this. Portia and both Jasper mentioned the infrastructure surrounding telemedicine, because we have what I would call the non-physical infrastructure, which is the technology, the internet, the video conferencing. But then it does require some form of physical infrastructure around it. It requires pharmacies, pill deliveries or medicine deliveries, possibly referral to specialists. Sometimes you have to see people in person if it is a serious case. So do we actually have the infrastructure to support really telemedicine in its entirety, or at least part of it, as we speak right now?
In terms of the various entities that we need, like for example, pharmacies we've got, medical doctors we've got, clinics we've got. But obviously in terms of the bridging the gap now, where we've got to then communicate, let's say someone calls, we've got a village health worker in the village, and she assists someone to then relay their symptoms and probably their prescribed with medication. What we now need is to be able to have infrastructure or systems in place that will then be able to deliver the medication. Because in terms of payment, yes, we've got mobile payment systems that the patient can use to pay for the drugs or pay for the service. But the delivery now, we need to have entities that can actually be able to run that at a cost-efficient price, so that they'll be able to deliver the medication, maybe pick it up at the local clinic.
So this is the infrastructure that we have to develop and put money into, I suppose,
yes,
to arrive. Portia, I am going to come back to you after the breather and ask you a similar question on that, but we do have to take a breather now on the Mint Special. Our discussion this morning is telemedicine safe and secure for Zimbabwe. This broadcast is brought to you by Zim Papers, TV Network, ZTN, and our partners, the Internet Society Zimbabwe Chapter, or ISOC Zimbabwe. Please look at their website, isoc.org.z. That's isoc.org.zw. In our final segment, we ask, are there any regulations in place in Zimbabwe that control the use of telemedicine? And is telemedicine the best way for Zimbabwe to reach rural communities that may have limited access to healthcare? Don't go away. The Mint Special will be right back.
Life will never be the same again.
Absolutely. No. How do you tell someone in Mbaria or in Soweto that they should exercise social distancing?
Every single one of us, barring a few, are praying more.
What is the health economic cost of what we are trying to achieve?
I don't know whether his chairman knows he runs at about 9 in the morning.
Yeah, I've just got those symptoms, so I just called the doctor and and then he just advised me to have to stay at home, eh?
Welcome back. You're watching the Min Special live from ZTN studios in Harare, Zimbabwe. Our discussion this morning is telemedicine safe and secure for Zimbabwe. This broadcast is brought to you by Zim Papers TV network ZTN and our partners, the Internet Society of Zimbabwe chapter, or ISOC Zim. Of course, their website, isoc.org.zw. That's isoc, isoc.org.zw. Portia, just before the break, we started talking about the infrastructure, the necessary, not just virtual, but physical infrastructure that's required around telemedicine. So I want you to ask your opinion if Zimbabwe already has that, does it have that infrastructure in place? And my second question to you, of course, is that implementing a new system requires training, and sometimes staff members find it difficult to welcome this change. Practice managers, nurses, physicians, and more have to learn how to utilize the system and also make it effective, in its implementation. So those two questions: how best you think we can achieve this training portion of telemedicine, and also, of course, the infrastructure surrounding it.
Okay, so thank you very much. As I said, as part of our pilot telemedicine project here in Manicaland, there's been assessments of the infrastructure, but also the technological requirements in terms of improving access to the internet and the necessary bandwidth, for example. But infrastructurally, we also found a number of issues to do with security, but also safe storage of some of the equipment that are required, for example, servers. But that can quickly be addressed, especially when you weigh the benefits of telemedicine, particularly now that we are embracing yet another crisis of COVID. But certainly in Chimanimani, there was then the cyclone Idai, really hindering further, the geographical access. So those are issues that can quickly be addressed. Legally, as I said, we have a Ministry of ICT, but we also have within government cybersecurity function, and they can take care of the security of information that is communicated using the telemedicine platform. There are issues to do with standardization, just to make sure, especially with images, for example, just to make sure that there's no distortion and people don't end up treating a wrong disease at the other end because there's been distortion. So those are the fine-tunings that need to be done. But also in terms of the practitioners' registration, there are regulatory issues, and I'm happy to say on the telemedicine issue, we already have had the Medical Dental Council on board, and I would think the other regulatory bodies quickly follow suit so that the practitioners, but also the practice itself, is effectively regulated. Coming to the capacitation of the practitioners, what we found working with the Ministry of ICT is the fact that we now need to train in basic telemedicine so that the consultants, even those sitting in private practice, can use a gadget to communicate to lower level cadres who are in remote locations and support them. But we definitely need to also come up with what I prefer to call hybrids, because there's no ICT person who knows medicine, and the medical people don't quite know ICT, and yet now we need to meet halfway and ensure that what we as medical practitioners require from ICT is taken care of, and also the ICT persons have an understanding of the health practice. So that may be additional cadres that need to come on board to effectively, embrace and utilize telemedicine for the benefit of the country. So that's something that we've already put in the documentation as part of the pilot work, but also informing the potential national rollout.
Okay, right. I mean, that's critical, isn't it, Sarathiel? The insect of integration, the insect of a network. I think that's what makes telemedicine work. It's not just phoning Harare, it's a network of cadres, if you can call it that, across the world. But I want to talk about some issues. Portia mentioned it there. About some of the concerns raised by critics in particular. Some, for example, issues such as patient reimbursement policies, privacy protection, those they come to mind. But also, one major concern, of course, is the possibility that fraudulent doctors may utilize technology. And unless there's some clear form of regulation or communication or understanding, patients are in danger when utilizing technology rather than visiting their doctors. I think a good example recently was the alleged fake doctor at Paranatua Hospital, one of our major hospitals in Harare, who was there for 3 months actually visiting and seeing patients without being caught. Now on the internet it even gets even worse because you don't know who you're talking to on the internet. Maybe you could comment on this.
Yeah, I think this is where the newer technologies will actually be able to assist us. We're talking of blockchain technology, that can be able to forfeit, fraud and be able to make sure that trustability of technology is actually put in place. Because what you want to do is to be able to build a technology that can be able to authenticate, to say this is the doctor that I'm talking to. I'm not talking to to some forgery expert. Yeah, and also the doctor on their end, they also want to be sure that they're talking to the right patient. It's not someone who's trying to maybe solicit some information in order to be able to then use it otherwise. So use of blockchain technology, use of AI technologies, and then ensuring that we are also complying to the ITU UT standards that are being developed, and also the HIPAA, which is the American standard.
This is back to what Jasper's saying, a centralized one system that everybody's using, not hodgepodge systems, and hopefully maybe a central control room, if I can call it.
Yes, there'll be need for authority. You need to have the medical practice or the medical experts being registered authentically into a system, and also the patients have to be registered into a database, and we're able to track those patients so that there's also logging in terms of the conversation that is happening, and there's someone else who has got to then to look at that log to make sure that the conversation that was being done, everything is above board, and what is being prescribed is also being verified.
And very briefly though, I mean, there's always this issue of doctor malpractice. If a doctor, for example, gives you a wrong diagnosis or issues you a wrong prescription. And in telemedicine, I mean, these sort of issues, I'm sure Portia can comment on that when I come back to her, these sort of issues have to be covered by regulation, of course.
Yes, regulations definitely have got to be regulations and policies, like in this particular case, through the ministry and also through the associations of the medical expertise. There must have regulations to that effect. And also on our part as technologists, we need to make sure that the technology is able to allow reviewers to review the conversation that was happening.
Portia, let me come to you on that right now. I mean, the issue here, of course, of fraudulent doctors, of course, of patients, reimbursement patients, or even paying doctors who work on telemedicine. How do they do that? And also, this issue of, I once a doctor friend of mine said to me that patients are the worst for telling you symptoms. When you ask them what their symptoms are, they don't actually tell you because they don't really know. And it's the doctor who has to find out. So how do we try and deal with some of these, which are real issues, are they not?
Indeed, and it's important to understand and discuss that before we go full-fledged on the telemedicine. But my belief is really that technology shouldn't take away even Ubuntu, even our basic professionalism and ethics and regulatory processes. If anything, we should actually use technology to enhance. So having said that, we really have to go into telemedicine practice knowing that there can potentially be these fraudsters around. However, I understand with technology, it may actually be more favorable because, as Saraseo says, you can have login credentials, you can block certain access. Even within the same institution, you don't allow everybody to view medical records. There are people that just want to know the date of birth or the patient's name and payment status, and that's it. They shouldn't have access to the clinical information or laboratory information. And using technology, you can actually effectively block that access, unlike dropping a piece of paper which ends up wherever we know where.
So are you saying is the ministry currently working on regulations to look at some of these issues that we're discussing this morning?
So yes, we do have a draft e-health strategic plan, and we have also married that very closely with our health information strategic plan, because we have already gone digital on our HMIS, the Health Management Information System, as far back as 2012. Okay. So infrastructurally, we are actually building up the telemedicine platform onto an existing electronic and digital platform. So some of the lessons and some of the queries you have, we've already learned as far back as 2012.
Right, and also we're not doing this. We're not the first out of the gate. I mean, telemedicine has been in other countries that's around. We have good best practices that we can follow.
Right. Yes. Right. Yes, indeed.
All right, Jasper, I want to just look at the. I mean, you're the IT guy here, sitting here on this program this morning. So let me ask you two questions. Every new technology or service delivery comes with some form of risk. So my first question is, what are the risks associated with telemedicine? And my second question is, what, if anything, does artificial intelligence and blockchain, we've mentioned it, both of you have mentioned it in our discussion today, blockchain, how does it play in the promotion of telemedicine?
I think in terms of risk, it's actually the biggest thing that we have. You know, technology and internet has always been a high risk in any trade. Worse off in medicine because it's highly volatile. We are talking about someone's life. We're talking about a community. We're talking about a group of people. Not only affecting the patient that you're holding. So technology brings in quite a lot of risk. But like what Portia has been saying, the Minister of ICT is in promoting the implementation of the cyber crime and data protection. Why do we say that? Because we feel that's where the basics come from. In terms of authentication and verification of who's going to be doing what and what exactly are they going to do with this information that they're going to get. It's unfortunate in the said scenario for Zimbabwe that we don't have a qualifications verification authority. We might have launched it, but we have not seen it do its work compared to South Africa, where you are capable to verify the person you're working with. So when you bring in technology in terms of telemedicine, it means people are also going to try and also design their own systems that we might try to deploy, which we are not so sure if they're going to really come up with. You've seen the online doctors. You wake up tomorrow and say, I'm an online doctor, and start providing a service. You might have 1 or 2 patients because it's easy that people can register things. Another issue that we also need to look at, Andy, is our DNS registrations. Some things actually appear as if they're coming from an authentic organization when it's not. Why? Because there's no policy that regulates the DNS registration. In Zimbabwe, I think in Zimbabwe, we've got what we call ZISPA. For instance, now it's only recently when they made changes to that, you cannot go and register a .gov domain. It means someone can go and register a similar domain that looks like a healthy services provider when they're not.
But here you're calling about an integration of, here we're talking e-health today.
Yes.
Okay. But at the same time, we're also talking about the ICT regulations that actually monitor and manage the ICT framework within the country. You're saying that these two must be meshed together to a certain degree?
These two have to be meshed together, including the consumer protection. We have to look at the consumers who are going to have the service to them. We have to mesh that. But we need to leverage on blockchain, artificial intelligence. Why? Because those applications are already there. And the reason why we need to regularize them and structure them is because they're working somewhere. They might not be working the way we want them to work. They might be causing more harm than we think it can be controlled if the regulation and structure is there on policy, so that we can have the Ministry of Health, we can have the Ministry of ICT, we can have the internet service providers also coming on board to ensure that we collaborate and promote the best thing for telemedicine in Zimbabwe.
Portia, you heard there what my guests in the studio are saying, particularly about meshing regulation, not just on e-health, but also looking at the ICT regulation to make sure some of the building blocks of fundamentals of ICT management are there. But I also want to ask you this. I mean, one major factor that telemedicine, as I said, I've had personal experience with this with my own mother, is using mobile medical devices, ECGs, vital signs monitors at people's homes, so that the monitoring or doctor or hospitals can monitor their health. Issues such as high digital resolution cameras for physicians to send detailed medical images to specialists, etc., etc. The infrastructure, if I can call it, the hardware required. So how achievable is this in Zimbabwe? Is this something that we can aspire to get to?
So yes, indeed, and I think we have gone quite a long way. If I remember well, one of the ICT surveys done showed that the mobile penetration was well beyond 90%. So it literally means every person in Zimbabwe has a cell phone or 2. So it's a good starting point, and we have already effectively used that in terms of delivering results for early infant diagnosis of HIV, for example, so that the mother just walks once to the clinic to get the blood taken and they don't need to come back to check whether the results are available. They are given already an SMS on their phone to say there's something to worry about or not. So we have already begun. And as I said, we don't want to look at it as very complex. I've seen very complicated telemedicine whereby teams of surgeons are, operating on a rare case, and there's one team in Manchester, one in New Zealand, and one in South Africa. So that's like the apex of it. But we just want to simplify and make sure that somebody from Bocha, for example, doesn't travel all the way to Harare, when a procedure can be done in Mutare with support from specialists sitting in Harare and assisting the Mutare team. And then they just drive a short distance back home on recuperation. So we already have made a lot of strides. And as I said, from the government side, the frameworks are there, the Ministry of ICT is there, the supporting ministries are there. And us as the user ministries just need to communicate and collaborate with some of the partners like the Internet Society, but also other providers. And the technical assistance is there. And by the way, when we started this work, we didn't even have the technical guidance or guidelines. But today there's a comprehensive and very full toolkit done by the International Telecommunications Union in conjunction with the World Health Organization. So we do have guidance where we can just quickly adapt, seeing our situation and adopt and then move.
Right. Okay, so at least we've made some strides. Sarathiel, I want to get your final comment because we do have to come to the end of our show, and a very interesting and enlightening program it has been, thanks to ISOC Zimbabwe chapter. But you heard what Portia said there. Let's not make this complicated. Let's simplify it, and let's get health delivery services to where it's needed, particularly in the communities in the rural areas in particular, who may not have access to healthcare, may have to walk many miles to get to healthcare, even wait in long queues. And even sometimes the doctor may only come once a week to that clinic to see cases. Yeah. So any further comments? What would be your final thoughts about telemedicine and its access or the way that we need to roll it out in this country?
Yeah, I think I would like to agree with Portia, because in terms of the structure already, we have got the local health facility. That is within reach. Oh, yes, it may be maybe a walking distance, or they may have to be a scotch cut distance to get to the health facility. But we are saying at that health facility, yes, there is a nurse, or there is someone else with expertise. And the ministry has deployed village health workers in communities. So we've got at least some basic medical understanding in the community. So with the mobile phone penetration, like she has already indicated, I think we're already probably around 100%. So using that basic phone, like I know my mother is out there in Chivu, she's got a basic mobile phone. So with the help of the village health worker, let's communicate to the next health service facility which is available, which is the clinic. And then the clinic, this is where probably we're looking at, they already have communication with their parent, maybe the district hospital and the district going up the ladder to the national. So we are trying to use that structure. So we can start by bridging the gap between maybe the community and the local health facility. And then the local health facility is taking it up to the district level, and then from there to the highest level. So we're using the store and forward, which is kind of the basic, and using the basic mobile phone device that we've got. Then as we improve the infrastructure, we can then continue now to say, yes, now we can have a high resolution like you were talking about. You need the high resolution camera. Maybe you've got a skin disease. You now want to take a picture and be able to send it, making sure that it gets there, it's exactly as it is, not modified along the way so that they will treat a wrong disease. So we then, I think, go step by step, improving. As we are improving the structure, we are improving the health delivery service, and we're improving also in terms of the capabilities that telemedicine can provide.
I think on that note, we have come to the end of our very exciting and, to be honestly, a very interesting program, because it deals with one thing, your health and my health, and that is critical to everybody. We've come to the end of the Mint Special this morning. Our discussion today is telemedicine safe and secure for Zimbabwe. I'd like to thank our panelists, Dr. Portia Manangazira, Director Epidemiology and Disease Control at Zimbabwe's Ministry of Health and Child Care, Sarathiel Chayepa, Information Systems Specialist, Higher Life Foundation, and Jasper Mangwana, President of the Internet Society Zimbabwe Chapter, ISOC Zimbabwe. Portia and my guests in studio, many thanks for appearing on the Mint Special.
Thank you for having me. Thank you, fellow panelists. Goodbye.
Right, goodbye, Portia. This broadcast is brought to you by Zim Papers TV Network, ZTN, and our partners, the Internet Society Zimbabwe Chapter, ISOC Zim. Please also visit their website, isoc.org.zw. That's isoc, isoc.org.zw. A final comment. Today, most people have access to basic telemedicine devices like mobile phones and computers. With improved accessibility, individuals in rural areas and busy urban areas can connect with a provider with ease. Home-use medical devices make it possible for caregivers to monitor everything from vitals to glucose levels. Physicians can gather essential medical information and make a diagnosis without patients stepping foot into their offices. Because of telemedicine, patients who had previously had limited access to health care services can now see a doctor without leaving their home. By 2020, telemedicine is expected to be a $35 billion industry and be a vital piece of modern healthcare delivery. While telemedicine has shown to be a game changer in the field of medicine, there are still a number of barriers to overcome. Physicians face challenges with regards to how they'll be paid and where they can practice, while patients, of course, have security concerns, and we've spoken about it on this show, whether they're dealing with a correct or fake doctor or physician at the end of the line. If these and other challenges are identified and resolved, telemedicine could become the most effective way to provide to millions of Zimbabwean citizens effective healthcare services. Telemedicine is clearly something that Zimbabwe should fully explore. I'm Andy Hodges. Goodbye, and you all be safe.